You are 29 years old, and the last thing you remember is the anesthesiologist telling you to count backward from 10. The operating room is colder than you expected. Not cold like winter, cold like a room that does not care if you are alive. Bright lights above you. A blue sheet across your chest. Machines breathing quietly beside your head. Someone places a mask over your face and tells you to take deep breaths. You try to act calm because everyone in the room looks calm. And when people in scrubs look calm, you assume you are supposed to trust them. 10, 9, 8. The ceiling begins to stretch. The voices get soft and far away. 7, 6. You think about how strange it is that a stranger can turn your body off with a syringe. 5. Then, nothing. At first, the nothing is peaceful. No dreams, no thoughts, no body, just a black gap where time should be. Then something returns, not all at once, not like waking up in bed. It starts as a sound, a dull metallic clink somewhere to your left, then a voice, calm, ordinary, bored almost. Someone asks for a clamp, someone else says your blood pressure is holding. You hear the words clearly, but your brain refuses to understand them. This is not supposed to happen. You are not supposed to hear anything. You are supposed to be gone. You try to open your eyes, but there is no response. You try to move your fingers, but nothing happens. You try to take a breath, and that is when the real fear arrives. Your chest does not obey you. Something else is breathing for you. Air moves in, air moves out, perfectly timed, perfectly controlled, and none of it belongs to you. You're awake, not fully, not normally, but awake enough to understand the shape of the nightmare. Your mind is inside your body, but your body has been locked from the outside. You try to scream. Nothing comes out. You try to swallow. You cannot. You try to blink hard enough that someone will notice, but your eyelids might as well belong to a dead person. Somewhere beyond the sheet, people are working inside you. You feel pressure first. Not sharp pain, not yet. Just movement where movement should never be felt. Tugging, pulling, a deep, wrong heaviness. Your brain searches for an explanation that makes this okay. Maybe this is a dream. Maybe this is what anesthesia feels like. Maybe everyone feels this for a second and forgets. Then the pressure changes. Something inside you shifts, and your whole mind lights up with one clean thought. They do not know I am here. That is the first lesson. Pain is not always the worst part. Sometimes the worst part is being present and invisible. You are surrounded by people whose entire job is to keep you alive, and not one of them knows you are trapped behind your own skin. They are not monsters. That almost makes it worse. They are careful, professional, focused. One of them adjusts a monitor, another asks for suction. Someone makes a small joke about missing lunch, and the room laughs softly. You want to hate them for that. You want to hate them for being normal while you are buried alive on the table, but they do not know. To them, you are a body under anesthesia, a patient doing fine, a number on a screen, a blood pressure, a pulse. A case moving on schedule. You remember what they told you before surgery. Awareness is rare. Complications are rare. You signed the form because everyone signs the form. The risks were printed in calm little sentences, buried between bleeding and infection and allergic reaction. Nobody reads those words like they are a prophecy. Nobody imagines becoming the tiny percentage. That is how fear works in hospitals. It stays theoretical until it chooses your name. You try again to move. Anything. A finger, a toe, your tongue, even a twitch. Nothing. The paralytic has done its job perfectly. Your muscles are silent. Your lungs are outsourced. Your face is useless. Your entire existence has been reduced to a conscious mind floating inside a machine-controlled body. The anesthesiologist is only a few feet away from your head. You can hear him. You can hear the soft taps of buttons, the paper rustle of a chart, the tiny alarms that mean something to him and nothing to you. You start praying for one of those alarms to betray you. A heartbeat too fast, a blood pressure spike, a tear slipping from the corner of your eye. Anything. You imagine the monitor screaming, telling them the truth you cannot tell. But bodies are liars under anesthesia. Some people panic quietly. Some hearts stay calm when the mind is burning. Some machines show numbers that look normal, while the person inside is falling apart. You wait for rescue from a screen, and the screen does not save you. Time stops being time. It becomes a hallway with no doors. Every minute is too long to survive, and somehow you survive it anyway. You count voices, you count metal sounds, you count breaths that are not yours. You drift in and out, but never far enough. Sometimes the room fades, and hope rises. Maybe it is over. Maybe you are going back under. Then a word cuts through the fog and drags you up again. Scalpel, retractor, more pressure, more hands, more impossible awareness. You do not know how long it has been. 5 minutes, an hour, a lifetime. In the dark behind your eyes, your brain starts making deals. Just let me move one finger. Just let me wake up after this with no memory. Just let this not be real. Then comes the second lesson. The human mind is not built to be helpless with perfect information. If you were unconscious, there would be mercy. If you were fully awake, there would be action. But this is the cruel middle place. You know enough to be terrified, but not enough to change anything. You hear your own life being discussed like a repair job. You hear someone say the procedure is going well. Going well. The phrase almost breaks you, because maybe it is. Maybe medically, technically, professionally, everything is going beautifully. Your body is stable, the bleeding is controlled, the team is doing exactly what they trained to do. The surgery can be a success while you are living through the worst moment of your life. Both things can be true. That is the part nobody wants to think about. At some point, your mind stops screaming and becomes strangely clear. You begin to notice tiny details. The rhythm of the ventilator, the smell of antiseptic, the weight of tape on your skin, the way the surgeon's voice changes when he is concentrating. You think about your family in the waiting room, staring at a vending machine, checking their phones, telling themselves you are in good hands. And you are. That is the horror. You are in good hands. You are not being harmed by cruelty. You are being carried through a system that is saving your life and failing your mind at the same time. You wonder what you will say afterward. You wonder if they will believe you. You wonder if you will believe yourself. Then, finally, something changes. The pressure stops. The voices loosen. The room's tension drops. Someone says they are closing. Someone else confirms counts. The worst is ending, but your fear does not understand endings anymore. You are still trapped, still silent, still waiting. Then warmth creeps through your veins, different this time, heavy and soft. The edges of the room blur. The voices begin sinking underwater. You want to stay awake just long enough to tell them. You want to grab the anesthesiologist by the wrist and say, "I was here. I heard you. I felt it." But the darkness comes faster than language. For the second time that day, your mind disappears. You wake up in recovery with a nurse saying your name. This time, your eyes open. This time, your chest rises because you make it rise. Your throat burns. Your body feels far away, beaten and swollen and strange, but it answers you. The nurse smiles and tells you the surgery went well. There it is again. Went well. You try to speak, but your voice comes out broken. She leans closer. You say, "I woke up." At first, she thinks you mean now. Everyone wakes up after surgery. You shake your head, tears already sliding down your temples. "During," you whisper. "I woke up during." The room changes, not dramatically. No one gasps, no one drops a clipboard, but something tight enters the air. Questions follow. What do you remember? Did you feel pain? Could you move? Could you hear voices? They are kind, but the kindness feels late. The anesthesiologist comes. His face is serious now, not careless, not guilty exactly, but careful in the way people become careful when reality has turned against them. He explains that anesthesia is not one thing, it is layers. Unconsciousness, pain control, muscle relaxation, memory. Sometimes, rarely, one layer is thinner than the others. Sometimes the body is still and the mind is not gone enough. Sometimes the system works and still leaves a person awake inside it. You want anger to come, clean anger, simple anger. It would be easier if someone had been stupid. Easier if someone had ignored an alarm or laughed while you suffered. But the truth is messier. Medicine is not magic. It is measurement, judgment, timing, chemistry, probability. Most of the time it works so well that people forget how terrifying it is to surrender their body to strangers. You did not forget. You never will. The third lesson arrives quietly, in the white light of the recovery room. Trust is not the same as control. You trusted them. You had to. But trust did not give you control. It only gave you a better chance. Weeks pass. Your incision heals. People tell you that you are lucky. The surgery worked. The problem was fixed. Your body survived. And they are right, technically. But they do not see what happens at night. They do not see you freeze when a phone vibrates like a monitor alarm. They do not see you avoid hospitals, documentaries, even the smell of hand sanitizer. They do not know that sometimes, lying in bed, you test your fingers just to prove they still belong to you. You move them one by one in the dark. Thumb, index, middle, ring, little finger, proof of life. And that is the thing nobody understands about waking up during surgery. The nightmare is not only what happened on the table, it is what follows you after. The knowledge that your body can become a locked room, that your mind can scream without making a sound, that calm voices can surround you while you are drowning right beside them. Before surgery, you thought fear was pain. Afterward, you understand something worse. Fear is being awake in a place where everyone thinks you are gone.